Hi, welcome to the Wirral Way. My name is Gill Torres, and I am the founder of this magazine and network that connects, supports, and celebrates the communities of West Kirby, Hoylake, Heswall, and the surrounding areas in West Wirral. In these interviews, I will introduce you to members of my network. These are people in our local community that are running businesses, running charities, hosting events, and doing some other wonderful stuff so that you can meet them, get to know them, and find out how you can get involved in some of the great things that are happening in West Wirral at the moment. Hi, and welcome to the Wirral Way. I'm Gill Torres, and I am here with Sue Fogarty of Timeless Skin Clinic. Welcome.
Thanks very much, Jill.
Yeah, I'm really glad to have you here, and we're going to have a little talk today about all things skin and aesthetics. And well, we were just talking before we pressed record, and the main focus I think of today is going to be us benefiting from Sue's wisdom and experience. I've been having worked in nursing and in skin for a long time to tell us what we need to know about our skin before we seek any treatment. Let's go back a little bit before I get into that. Tell us a little bit about yourself and your background. And I know about your many years of experience, but for our watchers and listeners.
Yes. So my name's Sue Fogarty. I am a registered nurse and I'm still working within the NHS currently 2 days a week. I was also a midwife for about 15 years. I'm no longer kept up with that registration because basically I'm sort of more concentrating now on my nursing background and my aesthetics pathway that I'm currently going down at the moment. Um, what I want to talk to you about a little bit more so than anything is about looking at things not just around putting aesthetics, Botox, dermal fillers in your face. What I want to look at is how we get to that particular point. What do we need to do to try and get us in the best optimum position to be able for those to look and natural and just generally tweak them rather than having to make significant changes to you.
Yeah, that sounds great because yeah, I think that there's a lot of talk online about aesthetics and what people have had done and what people need and what to do for different things. But I think that your approach, from what we've talked about before, is very much knowing where you are, knowing what you need, and looking after your skin as well as putting stuff in it, isn't it? So can you tell us a little bit about, I guess, what are the main things that we all need to know about our skin before we seek any treatment and how we go about finding that out as well?
Well, the skin is the biggest organ that you've got in your body, to ultimately at the end of the day. And it's the one that everybody sees. It's the outward appearance that you've got. And in order to keep that in a really optimum position, you need to be able to look at something from a holistic perspective. So you're doing it from an internal. So I know you've probably heard lots of medics and lots of different various sources, but ultimately it is about what we put inside our body and at different stages in our life. Obviously, the skin of a 22-year-old isn't going to be exactly the same as the skin of a 40, 50, and 60-year-old. And obviously, as you age, what tends to happen is there is multifaceted changes that are going to happen internally to you, which are then seen from the outside. Sometimes we can, I don't want to use the word abuse our bodies to a certain degree, but we do because we do participate in alcohol, various other kinds of substances that shouldn't be put inside our body, etc., etc. But also, we're not very good at actually looking after ourselves. I mean, the skin, as I say, is the biggest organ, and what don't we do all the time? We don't put an SPF on our faces at all. There's lots of information out there now about when I was younger, specifically, and I'd look back at my own childhood, is that we were lucky if we got a little bit of baby lotion on when we went into the sun. Now we know that we need to have at least factor 50 onto our faces and on our chest area. There's a high relevance of skin cancer, and I think it's because ultimately, we have got the global warming, etc. There is some gaps in it, and I think what's happening now is that's taking its toll on everybody.
Yeah, totally. I mean, I'm 44 now and I never started wearing an SPF till I was 43. And I think that, like, one of the things I've noticed in the last couple of years is how, like you say, your skin changes at different ages. That like up until like I never get sunburned, like tan but don't burn. So I never even thought to put an SPF on. And just in
Yeah.
the last year, if I have a glass of wine the night before, I can see it on my face the day after. If I eat too much sugar, I can see it on my face. So I suppose with that in mind, like, my question would be, what age and should people start doing things that if they're thinking about they don't want to get to like their mid 40s like I have and start to notice these little things, what can they be doing at 20 and at 30 to be looking after their skin? I mean, obviously you mentioned putting on an SPF and stuff.
So basically, it is around that. It's looking at your dietary factors. It's looking at your physical activity. It's looking what you actually put inside your system. We should be refraining a little bit from the use of alcohol, etc. But I think it's about just basically looking after yourself. And that changes in your 20s and your 30s. Life takes over. People haven't got as much time to look after themselves. There's a lot more emphasis now on physical activity and going to the gym. Um, it's just basically overall health. It's like keeping yourself in tip-top condition. And I don't like to look at people when they start talking around aesthetics and what we're putting into ourselves specifically from that. Because, ultimately at the end of the day, your skin is the biggest organ that everybody's going to see. You need to nourish that particular organ, and how you do that is by what you're putting in on it. But that will have changes as you go through your life in relation to it. I mean, obviously, when you do hit your 40s, and you possibly, from a lady's perspective, would be probably starting to come into the perimenopause. Well, hormones produce a lot more different things onto your body, the same way as it would have done when you were in your teenage years. So therefore, what you've got then is ultimately skin changes. You've got changes within the external factor, but deep down into the dermal layers as well. So it is about what we put in, but it's also about being a little bit mindful about it as well.
Mm-hmm. Yeah, I feel like I'm like living proof of that. Not that my skin's bad. I feel like I'm quite lucky with my skin, but I can certainly speak to the fact that like overnight I've started going, oh right, yeah, no, these little things that people say will sneak up on you with age are just about starting to now. And all of a sudden I've got like quite the skincare regime.
So I think as well, there's a lot of emphasis on the younger generation now in relation to making changes to themselves. So that can start very, very early on. I'm a lady, a slightly older lady generation. We didn't have mobile phones. We weren't influenced by what went on in the social media system, but there is a lot more emphasis on them. There's a lot more pressure on them at the moment to actually make themselves look more attractive to anybody. And it's not just about them doing some minimal things. Sometimes they're doing something quite dramatic. I mean, obviously, there was the incident that was all over the news last week, I think, in relation to a young mum of 5 who unfortunately has passed away due to a non-medical procedure, which should have really been done by a medical procedure. So, we've got to be very mindful that what we're talking to our children about and our young people as they're starting to grow up into this world is, we're not saying everybody's going to be perfect, and we're not saying everybody is going to be, looking 100% all the time, but we do need to look at it from a holistic perspective in relation to it.
Yeah, absolutely. In relation to what you were saying about that tragic story with that lady, if someone is seeking to have aesthetics done or to have these kinds of procedures, what should they look for? I mean, so I will mention at this point that you've got your wonderful clinic in West Kirby, and they can come to you if they've heard about your background as a nurse and stuff. But what should people, anywhere where they happen to be looking out for in terms of knowing that they're getting quality from the procedures that they're purchasing?
So I think when you're looking at what type of practitioner that you're actually wanting to go and trust yourself with, is you need to make sure, excuse me, you need to make sure that they're adequately trained in what they're actually saying that they're doing. A lot of people, you might find people that just start up this industry and they haven't had the appropriate training. That's sometimes reflected in the cost of the procedures that are being undertaken. I don't say that this has got to be done by a medic by all no means. I've got many of my close friends who are extremely practiced in what they do. Their skill set. They've been doing it they've been doing it a lot longer than I've been doing it in relation to it. Just because you're a nurse or a medic doesn't make it that you're better at them in relation to that whatsoever. But what I think you should do is make sure that you have a look about their qualifications, you have a look about what training that they've received and what they've undertaken. And then also, you know, any registered practitioner, we'd always be governed by our general medical counsellor or our NMC from a nursing or a doctor's perspective. But there's lots of other people that will have some kind of governing body surrounding them in relation to it. But most important, you need to make sure that they're practiced. You need to look at to make sure that they're fully insured. They've got the appropriate insurance for the procedures that they are going to be undertaking on you. And then you'd like to see their before and afters. You'd like to see some of their reviews from their previous clients that they've got coming through to you. And it's just about you finding somebody that is going to work alongside you and have the understanding and the wherewithal to actually take you through that journey, because it's a journey that you go through with your practitioner. So generally what happens is you find a practitioner that you feel comfortable with, and then you start that journey together.
Yeah. And so do you think that presumably you believe that people should be looking out for someone who's going to be saying what you're saying as well, which is to treat this as like holistically, skincare, aesthetics, all of that together, and what you're putting in and on your body. With that in mind, what if someone comes to you the first appointment and things, what can they expect? What can they expect to find out about the skin, you know, the beginning of that journey?
So when they come in to see me, what I suggest is that we always have a consultation. Before we do anything at all, we have a consultation. You very rarely get anybody just turning up on your doorstep saying, I want to put some kind of dermal fillers in my face. It doesn't tend to happen like that. There's lots of dialogue that goes backwards and forwards with a practitioner, people asking questions, you answering those questions. So, but when they actually come into the clinic, my first thing that I will do is we will do what we call a facial an analysis of their face. Let's have a look. What do they think their areas of concern are? And then, you know, I'm quite lucky because I've invested in a lot of medical devices that go alongside that, which are all registered within the UK. They've gone through all the regulations and so forth. But I start off with a facial analyzer, and that is a machine that's actually taking a series of photographs of the external of the face and about the deeper layers. Excuse me. It looks around the pigmentation, it looks about the previous sun damage, it looks to see if your skin's already dehydrated, has it got lots of sebum, is there lots of blocked pores, blackheads, etc., etc. And then at the end of it all, we actually get a printout that is pinged across directly to the client's own phone, so they can take that away with themselves, they can look at it themselves, and then we can come up with some kind of plan of where we want them to be. I will say for me is, if my clients come in and they've got an unrealistic expectation, and what I mean by that is, if they think that they're going to, you know, they're coming in at a certain age and they're going to be going out looking like a 22-year-old, they ain't going to get that with me. I can guarantee you that, because mine's all about enhancing what they've currently got. You know, a 70-year-old lady that wants to look 25, it just isn't a realistic expectation at all. And it's about enhancing what you've already got there, because ultimately at the end of the day, if you're not looking after yourself and you're dehydrated and you've got lots of skin damage and lots of pigmentation issues and you've not been looking after your skin in itself, what tends to happen is everything drifts down south, as you tend to get a little bit on the older side. So you can go around and you can put dermal fillers in, and you can put in anti-wrinkle medication and so forth, and they are really, really good. You know, I recently had Botox a couple of weeks ago, but what I'm trying to say is you've got to look at the internal structures, you've got to look at the scaffolding, and as I say, I've invested into some medical equipment. So I undertake here within the clinic radio frequency microneedling, which is to put control trauma onto the face, but it's about strengthening what's already there. It's about rejuvenating your skin and getting it back into a tip-top condition. It does work on fine lines and wrinkles, and that's why I haven't had any specific anti-wrinkle injections for over 12 months now, because it actually works on my fine lines and wrinkles. I mean, yeah, I was 60 last week, so you know there is an expectation that they will be there. But it also deals with different parts in your body as well. It actually works on scarring. It looks at scarring from surgeries. It looks at skin tightening in various parts of your body, your abdomen, your arms, your legs, anywhere that you want things to be tightened up. So, you know, I don't just rely on aesthetic treatments per se. I will use other pieces of equipment to be able to enhance and support it and to increase that scaffolding from underneath if you're looking at it from that perspective.
Fantastic. And I should just say as well at this point, because we talked about the analyzer, that is usually a chargeable service, isn't it? But for readers of the magazine and for people who are watching this, you've got excuse me, an offer available that people can get that analyzing done for free. So
Yeah.
I'll leave some information in the comments box below, in the description box, should I say, about how you can access that, and then they can go and see Sue and have your skin analysed for free, which is like sounds such a valuable tool to really equip yourself. And I guess, like, if you find out like, oh, my skin's dehydrated, then you can do a lot to support yourself in that, can't you? Like drinking water and all of that. And so following on from that, a question that I've got, I guess, is can you maybe give, say, 3, 4 top tips that everybody can do to at any age or a specific age to start looking after their skin better?
I think top tips to actually give to anybody at all is to look what you're putting inside your body. I know we all talk about it, but it is to have a good, healthy diet as much as we possibly can. Because if you're putting food into your body, that we all love certain amounts of food, but if you're not keeping yourself into a healthy lifestyle, it has an impact on your skin per se. You've got to increase your water intake. The biggest thing that your skin drives to get all the time. And you can tell if anybody's feeling a little bit dehydrated because their skin, you can actually start to see that it becomes a little bit crepey and it becomes a little bit dry and a little bit patchy. So it's about taking in the water. It's about good skincare regime. And I don't really, I will go on about having medical grade skincare, and that's what I will optimally say is the best form of skincare. But ultimately, if you're putting things onto your face, you need to know what it is, where it's from, and what effect it's actually going to have. And I think that is the 3 top tips, because ultimately you can come into any practitioner's surgery and you can receive various treatments. But if you're not continually and you're going to make a lifestyle change about it, you're sort of not going to get the full advantage of it. It's like 40% you, 40% us and 60% you. Because if you're just going away and saying, right, well, I'm not going to do anything else to be able to support it, it just won't work. It needs to be a conjoined effort to get to this point that you want to be in.
Mm-hmm. Yeah, sounds very sensible and great top tips. One thing I should mention before we wrap this up is your award nomination as well. So can you talk about that? What have you been awarded for, and what's it? How did that come about?
So basically, I'm a finalist in the UK Beauty Awards, which is the presentation is on Saturday, this Saturday, the 5th of October. And yeah, so I've been nominated to be a aesthetic entrepreneur of the year, which is really, really exciting for me. I don't want to say, but I've come into this particular industry quite late in my life. And I think for me, it was such an honour to be able to have received that. I mean, so we've got certificates and so forth. I'm not expecting specifically to win, but I would love to win. Yeah, it's just an exciting time. So yeah, very, very excited.
Yeah, how did you end up getting nominated for that? Do you know?
So I think I think so. What they do is they start looking at you internally, and they're obviously looking at it from a media perspective, and then they are then looking at your pages, you're looking at your reviews, they're looking at your before and afters, they are looking at the dialogues that you've got going on with all your clients through the social media, through your Instagram and your Facebook accounts. Because yeah, and it's what it is, and I think it's amazing.
Yeah, it's fantastic. Well done. And the way you've described that as well, like what they're looking at and what they've had to, observe about you in order to even get you to this nomination point, or certainly to the point of being a finalist, is such a fantastic endorsement for the service that you offer as well. So
Yeah,
well
I'm
done.
really quite proud. Me and my hubby are going down anyway to Birmingham, to the awards ceremony. So yeah, anybody that's looking at my Instagram page, expect to see a few nice little photos be coming up up after the weekend.
Great, yeah. And so, by the time this goes out, we might know if you've won. We might be able to include that So yeah, you have to keep us posted. So before we wrap up the bit talking about you and what you do and all of this, is there anything that we haven't covered that you'd really like to say?
No, I think we've had quite a good dialogue actually there, Jill. I mean, at the end of the day, so I don't want to harp on, but I have been a nurse since I was in my early 20s and I'm now 60. So you're talking 40 years worth of experience there. And a good chunk of it is around being a midwife. From a lady's perspective, I would say I've been a ladies advocate for the whole of my career. Um, I work specifically with ladies on the gynecological wards. I've worked on mums and babies, and considering the whole of my career is predominantly around the females. And, I'm happy to support anybody and point them in the right direction of where they need to go. I mean, I've done training around the menopause, etc., etc. And I'm not saying I am an expert in relation to it. I've obviously gone through it myself, and I still am going through it. But to me, it's about women making appropriate choices for themselves and having the confidence, because I know that when you do get to a certain age, your confidence does disappear. And sometimes when you become a mum and a grandmother, etc., you can tend to get a little bit lost. And it's about, some women sort of like wake up one day and they just say, my face doesn't look right, my body doesn't look right, I don't feel right. And it's, to me, it's all about empowering people to be the best that they can possibly be. And it's also about not taking advantage of that vulnerability as well. And I think that does come from my background. I think I would always advocate for the women.
Amazing, fantastic, and they're so lucky. People of this area are very lucky to have you there, doing that exact thing for them. So if you want to find Sue, you can find it on, it's the Crescent, isn't it? Your address, yeah.
It's in the Crescent, opposite Aubergine and next door to Hannah's.
Yeah, so that is in West Kirby, and I will put some information in the description and things. There was actually two and a bit final questions that I'm asking everybody in this series of interviews. The first one being about, where do you like to spend time on the Wirral? Whether it's out and about in nature or restaurants or anything, where do you like to go? Feel free to mention other businesses and places and things as well.
I would say the reason why I picked the Crescent actually is because I used to come to Hannah's. There's two cafes right opposite me. Aubergine is directly to my left, and Hannah's is directly in front of me there. And for the last 15, 20 years, myself and my friends have come to this particular area. I've got now two grandbabies. We spend a lot of time in Ashton Park, specifically, and going round. On the waterfront there. The beach is obviously always a big pull. We've got dogs throughout our whole family, so we do lots of walks at various points, and we do end up on Thurston Hill and on the Wirral Way, etc., etc. Don't get me wrong, I do like to go out quite a lot socially. I've got a good group of friends, and we tend to go and eat in different places. I mean, I love Oxton to go and have some food, etc., etc. And I'm generally just quite a little sociable person, really. So I've got my hands dipped in lots and lots of little areas, but specifically, I've always been drawn back to West Kirby because this is where I spend a lot of my time with my own children and now my children's children. So yeah, this is a particular warm feeling place for me, and it feels really, really like a little family, especially in the Crescent that we're here. It feels very much like a little friendly. All the services that are along here, we support each other. It's fab. It's really, really good.
Yeah, that's beautiful. Yeah, and it's great that you're a social butterfly, because you're the perfect person to make all those lovely recommendations to the people watching this. And then the last question, which you may have covered all of this in your previous one, but it's just an opportunity to, is there anything that you would recommend to people? So it might be a particular dish that you've eaten in a particular place, or somewhere you've been recently, something you've bought locally.
Right. So since I've been here, I am in and out of, is it called the Mill at the end of the Crescent there? So I'm in and out of that shop all the time. I'm
Oh, I'm
also,
sorry, what's that called?
I think it's called the Mill at the end here, the corner.
Oh, I do. Yeah, the mill
Yeah.
shop.
Yeah, and then obviously what they didn't have something in from the local one, so then I trundled off to Heswell because they had what I needed in relation to that. And then over the road, sorry, I'm looking because I can see where I am. Over the road, there's also a lovely little children's shop there. It's right on the corner of Banks Road, and I can't remember the name of it. but I get quite a lot of the stuff with the little grandbabies in there. So yeah, it's an area that I'm quite familiar with. I love the Row, I have to say. I like, you see, I'm now starting to sound like a lot of eating and drinking places. And there's the white, is it called the White Line or the Bridge Inn? I think it is. I can't remember the name. The big white one as you start to come down the hill.
Mm-hmm.
And yeah, so yeah, I do spend quite a lot of time here, really, more than anything.
Brilliant. And the very, very final question is, do you say in the Wirral or on the Wirral?
I live on the Wirral. Oh no, I live in the Wirral. I'll probably say on the Wirral. I'm from the Wirral. From the Wirral.
Yeah, but there's a the in there because I guess
Yeah,
some people say in Wirral as well.
yeah,
You're putting the in there.
yeah, yeah.
Yeah. Yeah. Okay. Well, thank you very much for answering all these questions. It's been really great to hear everything you've got to say. And yeah, thank you for giving us our exclusive offer as well for readers. Like I say, I'll make sure everyone's got the details they need and they'll know where to find you. So yeah, thanks very much for your time.
Thank you. Bye.